Live with Be Green with Amy.
Greetings, everyone. Welcome to Be Green with Amy. I'm Amy. After adopting a whole food plant-based lifestyle, my hubby Rick and I lost over 130 pounds. Now I coach others on their plant-based journey. Just Task Voice. Let's welcome our guest.
Dr. Jeffrey Pierce is a double board certified family medicine physician. He is passionate about using a whole food plant-based diet to help people get off medications and live longer, fuller lives. Please click like to help Be Green with Amy. Welcome, Dr. Jeffrey Pierce.
Greetings, Green Warrior, and welcome back, Dr. Pierce.
Hi, Amy. Thank you very much for having me on your show again. It's good to see you.
Yeah, we had you on a while back, a couple of times actually, and we're going to put links to that in the notes so that if people want to see the other things that you talked about with us. And if you have, Green Wars, if you have a question for Dr. Pierce, please type it in the chat and I'll ask him a little bit later. And I wanted to know if any of you are hoping to learn something about fatty liver disease today because of maybe something that you're going through or something that a friend or a loved one is going through. Let us know about that too in the chat because we want to be here to support you. Okay, so Dr. You know what? I think we'll just start. Let's just start with our game of true or false, and then we'll just get everybody in the groove of things.
It's time for True or False on Be Green with Amy Live. Answer true or false to Amy's questions in the comments below, and Amy will ask our guest for the expert answer.
Okay, and the first question is, true or false, fatty liver disease is now the most common liver disease in developed countries. What do you think, Green Warriors? Dr. Pierce?
Well, what a great question to start off with, Amy, because I think, you know, all diseases, all conditions are important, even if they only affect 1 in a million people. But fatty liver disease is not one of those that only affects 1 in a million people. This is a very common disease, and now it is the most common cause of liver disease in the developed world, and not just in adults, but also among children.
Oh my goodness.
Mm-hmm.
That's alarming. That really is, because especially for parents and grandparents, because I wouldn't think to even think of that being something that I would be concerned about with a young person. I think I always thought of that as something that would be an adult onset type of thing. Interesting.
Yeah, for real. I have a friend who's a specialist in kids with gastrointestinal disorders, and he says he sees this condition all the time. I don't know what percentage of children have it, but I know in adults, about a third of the population has some form of fatty liver disease. That's 1 out of 3 of us. So it's definitely worth spending some time to talk about today.
Yeah, absolutely. Okay, let's go with our next question. True or false, fatty liver disease is always caused by alcohol consumption? Okay, Green Warriors, type it in. Dr. Rogers?
So this is another important thing to talk about, because heavy alcohol use can lead to fatty liver disease. And it was certainly the cause of fatty liver disease that I saw the most when I was, say, medical school and residency over 20 years ago. So it's always important, if you get a diagnosis of fatty liver disease, to double check that it is not due to heavy alcohol use, because the treatments are different. But now the most common cause of fatty liver disease is from what we're going to talk about today, which is called metabolic dysfunction associated, or basically due to what we're eating and how we're moving and stuff like that.
Yeah, absolutely. Okay, we have one more true or false, and then we are going to move on. And I think I may have said Dr. Rogers when I asked you, because I just had Dr. Peter Rogers on recently, and I think that I might have slipped, and I apologize for that, Dr. Pierce. Okay, our last question. True or false, there are no symptoms of fatty liver disease until it reaches an advanced stage? Okay, Dr. Pierce.
Well, I think this true or false question hits another important point right on the nose, which is that, if you have really bad tooth pain one morning, you're probably going to go to the dentist if it's bad enough, if they have an appointment space for you, but you're going to go seek care really quickly because the symptoms start pretty soon and they're quite noticeable and you want to do something about it. That's one of the problems with fatty liver disease, similar to, chronic hypertension and prediabetes and early type 2 diabetes, et cetera, is that just like those, fatty liver disease is one of those silent killers, if you will, one of those conditions that just builds up and builds up and builds up without us knowing. Someone might complain of a little bit of fullness or a little bit of fatigue or a little bit of brain fog or something, but by the vast majority, there are no symptoms until it's way late, when the liver, this amazing organ, is really starting to poop out. And that's when you get some of those symptoms associated with liver failure, end-stage liver disease, like yellow eyes, yellow skin, itching, serious confusion, swelling in your arms, legs, and belly, things like that you see typically in someone with really late disease.
Yeah. And these, there's so many body parts that we have to think about, but I think the average person doesn't think about too many things about their liver and other things unless there's a problem. And the body is just such an amazing machine that how it, I always think about how it's kind of like we're operating electronically and molecularly, but yet it's not plugged in anywhere. It's just constantly doing things. And there's so many systems within the body operating, and a lot of them are so dependent upon the other. So maybe you could talk a little bit about, because maybe not everybody here is concerned about fatty liver disease, but maybe they just want to learn about it. So maybe you could just give us a little quick course about what the liver does and why is it so important.
Sure, it's a great question. I think we know that the heart pumps blood, and the brain is our supercomputer that processes our thoughts and feelings and emotions and senses and all that stuff. But we're not often thinking about our liver. So liver's a sizable organ that sits underneath our ribs on our right side, all the way to, and sometimes crossing over a little bit, our midline. So it takes up a good chunk of our upper right belly below our ribs. And it's an incredibly important and powerful organ. It acts in a whole bunch of different ways. It filters something like 6 cups of blood a minute. So every 10 seconds, a cup of blood is filtered through our liver. It's helping to remove some harmful substances, but at the same time, it's a factory. It's producing that liquid called bile that you sometimes taste in your mouth when you have been throwing up or something like that. And it's an important liquid, actually, to break apart or emulsify the fats in our diet. That's produced in the liver and stored in the gallbladder. And the gallbladder makes other things. It makes antibodies, it makes hormones, it helps to regulate our sugar because it's the storage organ for something called glycogen, which is what all those marathon runners want to get more of by carb loading before a race, because glycogen is turned into glucose when we need it. And it's also highly regenerative. It's one of the organs that's known for being able to take a bunch of damage and then to still pop back and to regenerate. And so when it gets to the point to where somebody needs a liver transplant, which is a major deal, right? It's an expensive surgery. It's a challenging surgery. There's risks. There might not be a liver available, all that kind of stuff. By the time that is necessary, the liver has taken a lot of damage. And so that's kind of an overview of the liver. I think the most common reason folks think about it is, oh, maybe I don't want to take too much Tylenol because I heard that could hurt my liver, or I got to watch my drinking because that can hurt my liver, or every time I eat, I get a sharp and really strong pain that lasts for an hour or two, and that might be to gallstones, and those are tucked away in the gallbladder, which is just underneath the liver. So those are some of the reasons why people think about their liver now and then. But I would say that not a lot of people are worried about what we call metabolic dysfunction associated steatotic liver disease, which is a mouthful that no one says over and over. So that's why we just call it fatty liver disease. And I think we should all be thinking and talking about it more.
Yeah, absolutely. And especially if I mean, it seems though that we're surrounded by things in our environment and in our food supply and all different things that probably can make its way there. Do you want to talk a little bit about that?
Sure. Well, let's see. One thing that one food, a very natural and in general healthy food that sometimes can do a number on our liver is if you went with your friends in the woods one of these foggy, rainy mornings, and you find some wild mushrooms. Well, by and large, you should never go foraging for mushrooms unless you're with an expert if you're going to eat them. And so because every once in a while, if you eat a poisonous meal of mushrooms, then that could do a real number on your liver. But thankfully, all those wonderful mushrooms that we recommend to include in our diets on a regular basis, like the brown buttons and the white buttons and the shiitake and the oyster and there's just so many really healthy, delicious mushrooms out there. Those you're typically buying at the store or growing in a grow kit that was sent to you by a reputable source, and you don't have to worry about that hurting your liver. But really, the foods that are damaging our liver are not natural foods at all. They are foods that have been sort of crafted in a laboratory, and it's the ultra-processed food category that is one of the major contributors to fatty liver disease. And so maybe before I get into those foods and what exactly is happening in the liver, maybe let's talk a little bit about I want to define the condition a little bit better, say a little bit about what's happening in the liver, and then let's talk about what are the foods and stuff associated with that. Does that sound good, Amy?
Yeah, that sounds great. And I'm glad that you kind of dropped that thing about the ultra processed foods, because I wanted to let you know, Green Warrior, that Dr. Pierce is going to be coming back in a few weeks, and he's going to be talking about ultra processed foods in more detail. So stay tuned for that. Okay, go ahead, Dr. Pierce.
Thank you, Amy. Fatty liver disease, this condition that is present in about 1 out of 3 of us in the United States, for example, is on a spectrum. So I would say on the low end of the spectrum, you have just some extra fatty deposits within the individual cells of the liver. More than the normal 5% or so is filled with fat, and nothing really dangerous is happening in the low end of the spectrum. Maybe it's seen on an ultrasound when you're getting an ultrasound for your gallbladder or something like that, and not too much dangerous or damaging is going on. But as you go along the spectrum, more and more stuff happens. So one is inflammation. There's actually damage done by this metabolic dysfunction associated with the fatty deposits in our liver that causes the liver to get inflamed. And while we know a little bit of inflammation, like when we scrape our knee and we have a little bit of local inflammation as the skin heals, that's good. A lot of inflammation and chronic inflammation is a bad thing. And so we have inflammation in the liver, and that's called steatohepatitis. Basically, hepatitis, any word that ends in itis tends to mean something is inflamed. Arthritis, iritis, cerebritis, all these myocarditis, all these fancy Latin words that end with itis just mean an inflammation. And so hepatitis, inflammation of your liver, and that's further along the spectrum in fatty liver disease. And that's when you start to see those lab tests, perhaps, that say, oh, hey, Mr. Jones, I was doing just your yearly physical labs, and we see that your liver enzymes called ALT and AST, those are elevated. And we're going to look into it and see what the causes are, but certainly one potential cause is steatohepatitis or fatty liver disease hepatitis. I'm going to go a little bit higher up the disease spectrum here to where things get more dangerous, and that's when the inflammation leads to scarring, also called fibrosis, and then severe scarring with liver dysfunction called cirrhosis. And I think most of us have heard of cirrhosis of the liver. Lots of us think about cirrhosis of the liver when we're thinking about people who struggle with alcoholism, but you can get cirrhosis of the liver from this condition as well, from fatty liver disease, due to what we eat and how we exercise. That is the big danger, right? So, because that's when you see the liver starting to fail, and you have all of those bad symptoms and signs that we mentioned earlier. And it's also can be associated with liver cancer as well. And so, thankfully, most of us are at the with fatty liver disease are at the early part of the spectrum, and some never go on to get the bad part. But a sizable chunk of people are getting more and more advanced liver disease due to this, and that's why, if it isn't already, it's projected by 2030, according to one source, that it will be the leading cause of the need of a liver transplant in adults. And so it's a big deal. It's a big deal, and we have to focus on that. So that's sort of the different types that folks might be dealing about. So if you hear, oh, I've got mild fatty liver, or you've got advanced fatty liver, that's what they're talking about. It's a spectrum. And then what exactly is going on there, and what's at the root of this? I think it's important to mention that it's our old unwelcome friend, insulin resistance. It's that setup that we see as the root cause for prediabetes and for type 2 diabetes. It is that state of metabolic dysfunction where basically our bodies aren't working so well because of, in large part, we're living a sedentary lifestyle, or maybe we're eating not the right foods, not the best foods for us, and our liver starts to not work well. Our pancreas doesn't work as well. We have fat depositing in our muscles, which leads to the muscles not being able to uptake glucose from the bloodstream. And skeletal muscles are one of the major users of sugar in our bloodstream. And so if the sugar can't get into our muscles due to all the fatty deposits in our muscles, that's one of the things that leads to diabetes. And we know that type 2 diabetes and fatty liver coexist in a whole lot of folks. And if you have type 2 diabetes and fatty liver at the same time, you're at higher risk for having complications from fatty liver as compared to somebody who just has no diabetes and early fatty liver, for example. So it's a lot of these things come together in a package. When you're admitting patients to the hospital, for example, no doctor in America is surprised when someone who's being admitted for a minor heart attack also has diabetes, also has a history of stroke, also has fatty liver, also struggling with their weight, because all of these conditions, these chronic conditions that we talk so much about, are related, some to our genes, but quite largely to what we eat, how we move, if we're getting sleep, if we're dealing with stress in a healthy way, if we have loving social connections, if we have a lot of toxic substances in our life, like cigarettes and alcohol and stuff like that. So that's a little bit more about that.
Interesting, because I have learned about well, I don't, not at a doctor's level, of course, but about metabolic syndrome. And it almost seems that there should be another kind of syndrome where the fatty liver disease enters in.
For sure, that's a good point. Actually, having metabolic syndrome is a risk factor for having fatty liver, and so it seems like we could just tack that on there if we wanted to. But yeah, having things like high triglycerides, high blood pressure, problems with your sugar, having a increased waist size above a certain parameter. That's what is metabolic syndrome. And doctors pay attention to that. Doctors and other healthcare providers pay attention to that, because when someone has metabolic syndrome, they're just at higher risk for these things that are our big killers. And this doesn't have, anytime we're talking about conditions that are associated with carrying excess weight and stuff, I always feel it's important to talk about how none of this is about fat shaming or saying that a certain body type is better than another. I think that our focus is, how do we help people live their healthiest life to where they have the lowest risk of dying early of a heart attack, a stroke, suffering from diabetes, suffering from liver inflammation and all that stuff. And that's why we're here talking today.
Yeah, I'm always so fascinated because, and I really am in awe of how doctors like yourself, you can see a patient and they don't even have to tell you anything. And you can just, and because, you go in for your physical exam, they say, and they look in your eyes and they tell you to say, and all that stuff. And they, pat on your back and it's, you just go through the motions and you don't really think about that this is real detective work. And before the person even could say any kind of symptom that they are having, you already have just absorbed so much information and processed so much information about their health just by doing those things, right? So somebody, for example, maybe you thought that patient did have fatty liver disease, you would see this upon the exam and be thinking about investigating further.
Yeah, it's an interesting topic to think about. I think there's some conditions where you can make the diagnosis as someone walks into your exam room, in the first couple of steps before they've sat down. There's some conditions where that might be a certain type of skin rash like psoriasis or eczema or something like that, to where you don't have to have even before you start chatting with your patient, you have a pretty good idea of what it is. Then there's the flip side. You can do a thorough exam on some folks and have no idea that they have that condition, and the answer is in the history. And so doing the history and the physical together yields the answer a whole bunch of times. Unfortunately, the way our medical system is built now, we don't have a whole lot of time to do a good history and a good physical, but we can write a quick order or type a quick order in the computer, and then that sends someone to the lab. It sends them to the ultrasound or to the CAT scan, and it allows us to see 15 people in a half day in a typical busy primary care or specialist practice. And that's one of the reasons why I try not to do that anymore, and I try to work in a more lifestyle medicine focused practice, to where we can have 30 minutes or 60 minutes per patient, because I think it's so important to be getting good history and to have time to do actual counseling with folks. But to your point, in something like fatty liver disease, you can have an idea, oh, look, this person has acanthosis nigricans, which is that sort of dark gray skin on the back of the neck, for example, that is sometimes associated with insulin resistance, type 2 diabetes. I wonder if they also have fatty liver. But to make the diagnosis, it does take some lab work and an ultrasound if you want to get close to the diagnosis. Unfortunately, the gold standard for making the diagnosis of fatty liver is, there's no one lab test, there's no one easy imaging study. They say that the gold standard is a biopsy of the liver, which it turns out not many people are trying to get to the front of the line for. And I don't blame them, right? It's invasive, it's painful, there's sometimes complications, and by and large, your doc is only going to recommend a liver biopsy if there's some serious doubt to the diagnosis and they're concerned for something else, typically. And that's usually when working with a specialist, a liver doctor, a gastroenterologist. Thankfully, we just kind of do our best and say, well, so you eat at McDonald's 3 times a week, and you've been struggling with your weight. Your liver enzymes show this, and your ultrasound shows this. We're going to make a pretty good educated guess that this is the metabolic dysfunction associated liver disease or fatty liver disease. And now we have a diagnosis, and the good news is that there's a whole lot of things that we can do about it that doesn't involve medication, and it doesn't involve surgery, and it doesn't involve a liver transplant if we really get down to it.
Yeah, that is very encouraging, because you think about how, I mean, that's all you've got. You've got that one liver, and you really don't want it to get to the point where you would be concerned about getting a transplant. And even if you could, you might not be eligible, or you might not find a donor that would match, and who wants to go down that road? And what's lovely about learning about this is that, and we've probably said it before, that it's not one cure for just one type of disease, that if we do things to prevent or possibly help reverse or manage this, that it would also affect other things as well. So it's kind of a win-win there.
Yep. For sure. Yeah. The fact that so many of these conditions travel together also means that they often have a very similar way to treat them, and sometimes reverse them, put them into remission, etc. So if you think now's a good time, we can talk a little bit about what we can do to help halt this condition in its tracks and reverse it, that kind of stuff.
Yeah, I think that sounds great. Go ahead.
Okay, so I think a great approach based on the scientific evidence to deal with fatty liver disease is a 4-step approach coming from 4 directions to address this disease. Number 1 is weight loss. Most folks with fatty liver disease are struggling with obesity, and the weight loss is one of the main ways to tackle the issue. There is evidence that even from 3 to 5% of body weight loss starts to put things in the right direction. And if somebody can lose more, like in the 7 to 10% range of body weight that is lost, that can even reverse some of these things that we see on liver biopsy, like inflammation and early scarring, the fibrosis that we mentioned. And so, any doc that you go to see in America, will say, oh, you need to lose some weight if they see fatty liver. And hopefully the discussion doesn't end there, right? Unfortunately, in a busy practice, and in somebody maybe who didn't get much training on how to approach weight loss, that might be kind of where it ends. And then you're left with like, oh, I guess I'll just look online to see what are some ways to lose weight. But weight loss from just about any cause can help fatty liver, but we want to do healthy weight loss, right? Michael Greger says, like, the purpose of weight loss isn't to fit in a smaller casket. It's in other words, we don't want to lose weight from a cocaine habit or from a smoking habit or from starving ourselves or some of these ways where weight comes off, but it's not good for us overall. We want to find what's that way where we can lose weight in a really healthy way. So working with your practitioner on what are healthy ways to lose weight is super important. And I think that ties directly into the second step of of our approach is adopting a plant-based diet, a whole food plant-based diet as much as possible, because one, the whole food plant-based diet, if someone was eating a more typical American diet that's higher in processed foods like fast foods and packaged foods, and higher in like saturated fat foods, pastries, animal products, things like that, full fat dairy, etc. That person who is switching to a low-fat whole food plant-based diet is going to see weight loss naturally, because this diet is just so much lower in calories. It's lower in calories, and it's also richer in nutrients, and that's why it's not just about weight loss. It's about what are the wonderful things that you get when you switch to eating this sort of diet. The antioxidants that are so plentiful in this diet, anti-inflammatory compounds, healthier fats, like the fats that are found in nuts and seeds and avocados, instead of say lard and butter and some of these things that have just higher amounts of saturated fat, which have more calories. And we know that saturated fat is the major driver of cholesterol levels in our blood, and that's related to heart disease. And so there's so many benefits of switching to this sort of diet. And I think that at the root of it is that it helps to reverse insulin resistance. And so if you happen to have prediabetes or diabetes, that's going to get better as your fatty liver gets better. Because that fat that we talked about earlier that's in our skeletal muscles starts to mobilize and get out of our skeletal muscles. Our liver starts to work better. Our pancreas doesn't have to work as hard to get better results. And so the benefits are just multiple from eating this kind of diet. We also know that there are certain spices in a healthy diet that can, based on research, can help with their antioxidant effects for fatty liver. Things like ginger and turmeric and Nigella sativa, which sometimes you hear called black cumin or charnushka. But Nigella sativa is basically a super healthy spice that helps for many conditions, and it's been shown potentially to help with fatty liver. And before we leave the diet, I would say one last part about how it helps fatty liver is we think that dysbiosis, which is basically an unbalanced, not optimally working gut microbiome, we think that dysbiosis plays a role in fatty liver as well. And so this type of diet, which is full of something called prebiotics, so things like fiber, resistant starches, where we don't digest it, but by the time it gets down to our large intestine, our microbiome gets to work on it, our microbiota gets to work on it, and it produces all these lovely compounds that keep us healthy. And so we want more fiber in our diet. It turns out that not only does fiber help keep us regular, but it helps with things like diabetes and fatty liver disease and inflammatory bowel disease and heart disease and all these things together.
Yeah, it's so important to know that. I think when you were talking about fat, people may have the notion that when, like, if they were eating meat, that they would see maybe meat like on the side of the meat, and they'd think, okay, if I just cut that part off, then I don't have fat. I'm not eating any fat. And really, or they think about their body and think, oh, when I gain weight, the fat goes to my belly or the fat goes to my hips. And I don't think that many people think about how fat goes everywhere, right? Because you were talking about the muscles.
Yes, yeah, that's a great point. Right. To address the first part of that, even lean cuts of beef and even chicken with the skin taken off and all these things, they're even all animal products just have higher amounts of fat. I guess no fat dairy would be an exception, right? But animal products just have fat, even if you're going for the lean cuts. If you were if you had no access to food, 10,000 years ago, and you depended on that wild bird that you caught to live, that's one thing. But now we have better options, right? We have chickpeas in general would make a better option than eating a chicken, because chickpeas has tons of protein, but it also has fiber, and it's also low in fat. And it has vitamins and minerals, etc. And so I think, yes, your point about lean cuts and meats can be deceiving to us in general. Then the second part of that, you're talking about how what we see in the mirror is one thing, but what's going on underneath the hood is something very different. And the most important type of fat on our bodies is not what's hanging around our midside or our hips and buttocks, but it's what's in and around our organs. That visceral fat, which is so dangerous for heart disease risk and metabolic risk, the fat that's in our muscles. This is the type of fat that's doing the most damage. And in a reminder of how amazing the human body is, this is the fat that is dealt with first. That when somebody starts eating healthier and exercising more and doing all these things that we're talking about today, this is the type of fat that melts away first, which I think is so elegant of a system our bodies are, to try to get rid of some of the most dangerous fat first.
Right. So that if you are losing weight, hopefully that you have adopted a whole food plant-based lifestyle, and you're doing it that way and not in a risky way with some of the fad diets out there or medications or whatever, that if you didn't see the inches come off, you are still in a healing state, because you are losing, like you said, the fat in the most critical parts of your body.
Yeah, that's often what seems to happen. And you mentioned medications, and I should have mentioned that when we were talking about weight loss, with all the popularity with the GLP-1 drugs like semaglutide, Ozempic, and these related medications. They definitely can help with weight loss. They definitely can help with fatty liver. But we know that if there is a way to do it in a more natural, more healthy way, it's better for us, right? Because the medications are expensive. Weight loss plateaus at a year. The symptoms associated with it, with the nausea and the sometimes other GI distress, it's not fun. Now, sometimes that's really the only thing that's going to work with somebody, and I support it. But if somebody is considering these GLP-1 meds and has not tried a whole food plant-based diet for a solid 6 months, then I think we're missing out on a method that leads to weight loss, and it leads to greater health, and it's better for the environment and the animals, et cetera, et cetera. So I guess weight loss and a whole food plant-based diet are the first 2 steps, and we got 2 more. What do you think, Amy? Shall we keep going?
Let's tell them the next step. Absolutely.
Okay, so in addition to what we eat, it's important, it turns out, when we eat, because many of us live sort of a lifestyle where we're busy at work, and maybe we didn't have time to eat. We coming home late, and we're eating a late dinner, and then we're so pooped from a stressful day at work that we're gonna watch some Netflix stuff, and then it turns out maybe some late night snack goes quite well with the third episode of Netflix stuff you're watching that night, and then you have to go to bed for 5 or 6 quick hours of sleep, and wake up early, and you got to eat breakfast on the way to work, because maybe your work doesn't allow you to eat eat there, etc. And so a lot of us don't end up having any kind of a overnight fast of anything worthwhile to our bodies. Our bodies really can focus on some really important metabolic tasks when our body is not busy digesting. And it turns out that having at least 12 hours of time with no additional calories coming into the body is beneficial for things like diabetes and weight loss and fatty liver. And if you can make it so 12 hours means you finish eating at 8 and you don't have your first bite of food or drink of calorie food until 8 the next morning. But if you could stretch that to 14 hours, some people even stretch it to 16 hours of fasting, which is quite difficult, but doable for some folks. Then your body just has more and more time to break it down. But this is just one type of fasting that we're talking. We're talking about time-based eating or time-restricted eating. There's also the types of fasts where you're like, you know what, on Sunday, it's going to be a mellow day. I'm going to just stay really hydrated. Saturday night, I'm going to eat my dinner, finish eating by 8 o'clock on Saturday night, and I'm not going to eat until Sunday night at 8 o'clock. So that would be a 24-hour fast where you're staying hydrated. You're not running a marathon or anything too stressful, and that gives your body time to work on these other tasks, like get rid of fat from your liver and your skeletal muscles. So I bring up the time-restricted eating and the multiple ways to do a fast because studies have shown that either the liver seems to get better on maybe an ultrasound or a lab test. The liver enzymes get better in these studies that look at different types of periodic fasting. And so work with your provider, see what works for you. Maybe just a long overnight fast is your way to go, or maybe once a week, maybe once a month, maybe going to one of these great centers like the True North Health Center here in Santa Rosa, Northern California, might be what you need to really jumpstart your fasting regimen. But there is some benefits of that for fatty liver. And so I recommend taking a look at that. So 1, 2, and 3, that just leaves one more, unless there's a question about the fasting from anyone.
Yeah. I guess we should probably say that, of course, if you have diabetes, that type of fast, that particular helpful step might not be appropriate. And then, of course, also, we wouldn't want to go longer than maybe 24 hours if we weren't supervised by an expert.
Yeah, those are great points.
Fasting.
Those are great points. Alan Goldhammer from True North would be quite happy that you mentioned that. I think specifically type 1 diabetics can't, people living with type 1 diabetes can't do prolonged fasting, but can certainly do, a typical 12-hour fast overnight. Most folks can, but even folks with type 2 diabetes who are on insulin or other medications that can lower your blood sugar, you want to be very careful about this because you'd have to adjust your insulin. So always work with a healthcare practitioner if you are on medications that lower your blood pressure, lower your blood sugar, when you're thinking about doing anything more than like a 12-hour overnight fast. And yes, the prolonged fasts should be medically supervised for sure.
Yeah. And I think it's so interesting. I'm trying to remember where I read somebody had talked about the not eating too close to bedtime, and they kind of compared it to Disney World. And they said every day Disney World has so many people coming through, and there's so much trash and things going on. And at the end of the day, they have to close the park and let everybody out, and then really go ahead and pick up all the trash and clean everything that needs to be cleaned. Because to try to do that at the same time while all those busy park patrons are running around doing their thing, it wouldn't be doable. So in a sense, this intermittent fasting and fasting is kind of the same thing, where your body, it can't just do everything effectively when you're trying to give it so many things to do all at the same time. So that's a really great step to try to take, and I think that it's going to be very helpful to people. All right, so what do you got next?
I think that's a great metaphor, Amy. I think I'll use that if you don't mind. I
Yeah.
think I
Well,
would
it's not mine. I stole it from somebody else, but I
someone else,
can't
right?
remember who
I,
told me.
yeah, I think I used Mardi Gras as an example in the past, but I like Disney World. And not only do they need to have that time at night to clean up all the, trash and all that kind of stuff, but also to like, repair the rides and make sure they're safe for the next day and all these sorts of things. And that's very similar to what happens in our brains when we sleep, that glymphatic system that really washes out all the junk and gets it ready for us the next day. And why, when you're chronically sleep deprived, like a lot of people in medicine, but a lot of folks, no matter what your specialty is or what your field is, our brains don't get that processed time to do some upkeep and all that kind of stuff. So great example. Thank you for that. That leads us to our last step. So we talked about weight loss. We talked about adopting a healthy, whole food, plant-based diet. We talked about different types of fasting. And then the last is exercise or physical activity or daily movement, however you want to look at it. When you look at the studies for exercise, they show that exercise reduces liver fat, even if there's no associated weight loss. So if somebody just say they don't change their diet and they just start exercising more and they don't lose any weight, you can still see a reduction in liver fat from that exercise. A meta-analysis, which is a review of multiple studies, I think there were 30 studies in this one, showed that diet and exercise together reduced body weight, insulin resistance, and fatty liver better than just doing a diet or just doing exercise. And we know that outside of fatty liver disease, exercise is super important for things like reducing our risk for heart disease, the number one killer of all adults in America, and reduces our risk for cancer. And so, we want to say shoot for at least 150 minutes of exercise a week, but more is better. I think what some real go-getters aim for is 300 minutes of moderate exercise a week. So like 5 hours. Is that about 5 hours? Something like that. That is a moderate exercise. So if you happen to be able to do some vigorous exercise, so the kind of exercise that's so hard that you have trouble speaking in full sentences because you're out of breath, like that's typically in the vigorous range, and even half the amount of time doing vigorous exercise counts. And so try to get at least that 150 minutes of aerobic exercise in, a couple of days of weights, and working on stretching and balance as we get older is the prescription for exercise in general. And we see how that helps in so many ways.
Yeah, that would definitely be helpful. And I think that maybe we could clarify, because maybe some people think, okay, that means that I have to go and carve out this certain block of time every day, which some people, they don't find that possible. So can the daily movement be broken up into segments throughout the day?
Yeah, that's a great question, and I'm sure you're so good at this when you work with your clients about how some folks just are allergic to exercise, and I don't blame them, because I guess we were talking about this the other day with some coworkers, is that we as a species we are very good at conserving our calories, because from an evolutionary standpoint, we need to guard our calories, because we don't know when we didn't used to know when the next meal was going to come around. And so the idea of just, okay, I don't know when we're going to stumble upon the next tubers or berry bush, or kill a mammoth or whatever. The idea of, hey, but I'm going to go for a, hour-long jog real quick before hunting or something like that. It just doesn't make any sense, because we used to need every calorie that we could keep But of course, that situation is vastly different now, right? You can find food everywhere. You can walk into Home Depot and have, food at the checkout line, and so there's no shortage of calories. And so we now need to work harder. Of course, we're also sitting more because of this lovely computer that's in front of us, and TVs and jobs that don't involve hard manual labor. Our society is just different, and we have a sedentary type lifestyle, so we have to work hard to actually get up and exercise. Now, does that need to be putting on the spandex and going to some fancy gym? Well, for some people, they dig that. But it can also be like what I was doing today, my off morning. I was carting around heavy 5-gallon buckets full of compost and mulch and stuff, working in the garden, right? We like to grow a whole lot of our own food. And that involves work every day that we can do it. As I was shoveling, I was thinking, okay, that's a lunge, and I was lifting, the right way. That's a squat, and it all adds up. Some folks say, hey, I can do a 15-minute walk after dinner, and that's what I got. Well, then go for it. And if you can do that, 5 days a week or 4 days a week, it all adds up. If you have a dog, dog's got to go out. So find what doesn't feel like a chore. A lot of folks get a benefit from team stuff, throwing the frisbee around, throwing the ball around, shooting some hoops, whatever it is. You want it to be, you want to try to make it rewarding to you immediately, because it's going to be rewarding in the long run. But we're not really good at seeing, well, I'm going to do something that's not so fun just because some possible benefit 50 years from now. We want to see the immediate benefit. And for a lot of people, that's the endorphin rush, or just getting to hang out with your friends, or getting a bushel of, potatoes after working all day in the garden and harvesting, or whatever it is.
Yep, just that's the prescription, right? It's what's the best exercise for me to do, the one that you will do, yeah. Right? So that's very important. Okay, well that's wonderful that all the information that you gave us today. I'm going to be moving on to questions pretty soon, Green Warrior. If you have one, please type it in the chat. Dr. Pierce, did you have anything else you want to talk about before we go to the questions?
I think that's mostly it. You might see, just for completeness, some folks mention vitamin E might help for fatty liver. I always say talk to your healthcare provider about it, because there's some studies that also show maybe an increased risk of prostate cancer or stroke or even death associated with taking high dose vitamin E. So that's not something I recommend on a regular basis. If you do have fatty liver, do your best to protect your liver from other things. So if you have fatty liver from diet, you can protect your liver by avoiding excess alcohol intake, limit liver toxic meds, make sure you're vaccinated for things like hepatitis A and B, because you don't want multiple hits to your liver. And then lastly, I'd say that something that we haven't talked about is bariatric surgery, which is weight loss surgery. They have really high success rates of reversing fatty liver disease in folks that have weight loss surgery because of the associated weight loss. These are major operations that are expensive and risky and have lifetime consequences. And so, I always think of those as a sort of last resort for folks who have tried the sort of approaches that we've been talking about today.
Yeah, I'm glad that you did talk about that. That is so important. There's a lot of information on the internet, and sometimes conflicting information, and we just don't know what we should do. Okay, I think we have a live question now. Greetings, Anne. So how do I know if I still have fatty liver? Okay, I have since lost 100 pounds. Well, congratulations on that. That is so wonderful. Mainly due to gallbladder issues. Sorry about that. Could just the weight loss have resolved the fatty liver issue?
Yep, great question, Ann. I hope things are going better with your gallbladder. Yes, 100 pounds is such a significant amount of weight to lose, and that alone could have reversed your fatty liver. And so it depends on if your doc saw, abnormal liver blood tests or an abnormal ultrasound, then they would want to check that again now after the weight loss and see if that has resolved. If, I don't think this is what you're doing, Anne, but if someone told me, hey, I lost 100 pounds because of gallbladder issues, my fatty liver disease is probably better. I want to, that means that I can, drink 6 Cokes every day and not exercise and all these other things. I'd say, well, don't look at it that way, right? Look at these 100 pounds off as such a wonderful kickstart to your health in general, and how still following all those steps that make fatty liver better that we talked about today will continue to keep it at bay, will help all the other things like heart disease and diabetes risk and things like that. And Anne says, oh, they removed my gallbladder 2 months ago. Good. So hope that is hopefully something you never have to worry about again. Just follow up with your doc and wishing you best of luck. I'm never going back to eating like that, like you were before. Well, good for you. That's awesome. I'm sure if you're watching, Amy, if you're watching this channel, you have done some amazing things with your life, and congratulations, because not only does it improve your present and your future, but it affects those around you. Family and friends have seen what you have been able to do, and that's very uplifting and encouraging. Nope, we lost your audio.
Very, very encouraging. I'm glad that you shared that with us, and because it's going to be very encouraging for people that are watching as well. So Roxy said, is there any natural supplement we can take to protect our liver?
It's a good question. So there are folks who are trained in integrative medicine and functional medicine who delve more into supplements. As a family doc and a lifestyle medicine doc, I'm not a super expert in supplements. There are a couple of supplements that come to mind for fatty liver. If you think of spices like supplements, we mentioned the ginger, the turmeric, and the Nigella sativa. There are also omega-3s that have been shown in studies to potentially help with fatty liver. And so remember, the foods that have those are flax, that have high amounts of that are flax, chia, hemp, a little bit less in walnuts, less in brassica vegetables. And then some people would prefer to get the long chain omega-3s. These are essential fatty acids, by the way, that we're talking about, but the long chain of omega-3s, EPA and DHA, which some people get through fish oil pills, but I recommend to get it from where the fish get it in the first place, which is from algae. And so getting an algae-based DHA EPA would be another supplement that could help the liver in the case of fatty liver disease. There is, in the back of my mind, some folks have said, oh, to help my liver, I take milk thistle and different things like that I just don't know very much about. So you'd have to talk with your doc or other healthcare provider about that.
Yeah, and I'm glad you helped explain that, and I'm glad that Roxy brought this up as far as natural supplements, because as we were talking, that our liver is processing the things that we're putting in our body, and if we grab all these over-the-counter supplements and things like that, maybe some of them are beneficial, but we really don't know if we load up on all these different things, that still has to get processed through the liver, and that's what we're trying to save here. So those natural supplements or natural remedies are easy to think about, that they may be more something that we should address first. So, and I think that people will probably be asking as far as the black cumin, as far as the dosage goes.
That's a good question. I don't think I have in my notes easily handy the dose of black cumin. Yeah, I don't have the dose. When I think about it as a just addition to food, right? And so there are a couple ways to do it. It is a component in South Asian cooking, like Indian and Pakistani cooking, and so you can just have it as one of the herbs and recipes that you're making. Dr. Greger puts it in a spice mix that he has in a grinder, and so he has Nigella sativa and I think also black pepper and some other things mixed in, and he just grinds it and puts it on top of his food as a seasoning. And so I don't think of a particular dosage. I just think about trying to get it in our diet. There's I'm going to type something in here in my notes that's funny. I must have gotten this from Dr. Greger because he said that there are 1,000 papers in the medical literature that have looked at Nigella sativa over the decades. And there's some evidence for weight loss, cholesterol, triglycerides, blood pressure, blood sugar, the fatty liver, and also Hashimoto's, which is a type of autoimmune thyroid disease. And when I think about the dose for Hashimoto's, it looked like one study looked at 8 weeks of a half a teaspoon of powdered Nigella sativa led to weight loss, but also decreased thyroid levels in people who had and lowered thyroid antibody levels. It was a randomized double-blind trial, and it also they saw LDL, the lethal or the bad cholesterol, fall by 17% in the same study. So that was at a half a teaspoon a day, but they were looking at things like weight, cholesterol, and thyroid, and not specifically about fatty liver. But if they were doing a half a teaspoon of powdered Nigella for those things, and it seemed to be beneficial, then that might be roughly an amount that could potentially help. But I don't remember the specifics from the fatty liver studies.
Yeah, I had heard this so long ago from Dr. Michael Greger, who talked about weight loss, that black cumin was helpful for that. And in my mind, I remember a quarter teaspoon, but I don't want to say for sure. But I do take it, not for weight loss, but because it has so many other benefits. And when I first tried it, I was very surprised because it's very potent.
It is potent.
Yeah. So now I grind it up and I put it in my smoothie, and then I don't notice it. But I don't know about sprinkling it on top of food.
Yeah, it can be quite the flavor. I personally like it, but some people don't. Okay, so I found that study. It's by Tang, is the lead author, and I will maybe I'll put it in the chat to you, Amy, if folks want to try to Google it. But it says a systematic review and meta-analysis of randomized controlled studies for Nigella sativa in the treatment of non-alcoholic fatty liver disease, and that was back from 2021, so just a couple of years ago.
Yep, and that's what I like about having you on, because you're always giving us the evidence-based medicine, right?
Try.
And that's so important. And I'll put that in the show notes as well.
Yep.
So yeah, so those are really great answers. Thank you so much. And I wanted to invite the Green Warriors to please click like to show your appreciation for what Dr. Pierce shared with us today, because it was a lot of great information. And I would like to give you this opportunity now, Dr. Pierce, to tell us about what you do and how we can find you.
Oh, well, thank you very much. I see patients in a couple of different places, but one place, if folks are looking to see me as a doc, would if you live in California, Texas, or Florida, I could see I'm thankful and lucky to be part of the group of docs that love life telehealth, and we just changed our web address, and probably that one will get you there. But the easiest and most direct is telehealth.love.life.
Oh, wow.
And that's sorry for not getting that to you, but yeah, telehealth.love.life. And the group, we cover all 50 states, and we can order your labs, and one of the best parts is that we get together twice a month, and we can talk about challenging cases, things we've learned, and we're texting each other very frequently about, hey, have you heard this interview? Have you seen this study, etc. So there's a lot of learning that goes on, a lot of sharing, and I feel very lucky to be part of this organization.
Yes, and I've had the pleasure of interviewing many doctors there, and they are all spectacular. And did I get that right now? I did it wrong. Telehealth.
Almost, yeah. You don't need to do the com part. It's just telehealth.love.life. Yeah.
So that's instead of the .com.
Yeah. These newfangled web addresses.
Very nice. Very nice. Yeah. And as I was saying, that you are just a part of such a wonderful team, and it's so nice to know that if somebody chooses to consult with you, that you will have that ability to go to the rest of the team and discuss things with them to get feedback about things if you needed to.
Yeah.
Right. Yeah. And then I wanted to, you still have your Instagram, Dr. Pierce?
Yes. I think it's at Dr. Jeff Pierce. And that's, I have a lot of fun on that one. Mostly I'm showing things that we're growing in our garden, but we do a little bit of other things as well. Yeah, thanks for sharing that as well.
Yeah, it's a lovely Instagram that you have, and it just showing that you can, anybody can grow something, even if they decide to grow an herb in a pot on the windowsill. And there's always ways to get things in your gardening somehow, and that's a wonderful thing, to get those fresh herbs, even if you can't do any other kind of gardening. So I really wanted to thank you, Dr. Pierce, for shining a light on the dangers of fatty liver disease, and empowering us with the knowledge to heal naturally.
Well, thank you. I think it's a topic that we should all be talking a little bit more about, and I appreciate getting a chance to speak with your Green Warriors today.
So, Dr. Pierce, what's your final take-home message for our Green Warriors?
I would just say that even though this is a common condition that could be really, really serious, it's something that we can definitely take control of with just, four simple, not always easy, but 4 simple things: weight loss, eating a plant-based diet, exercise, and fasting. And with those 4 things, we can really turn our body around. And if you've tried these things by yourself and you're struggling, reach out to Amy, reach out to us, reach out to your primary doc, say, give me some more ways to tackle this, because I don't want it to be part of my legacy. I want this to be part of my past.
Very good. Yeah. And Green Warrior, tell us, what are you going to remember from today? I have a takeaway, but I can't remember exactly what it was, because my takeaway was that it's no longer called non-alcohol fatty liver disease.
Yeah.
So, Dr. Pierce, tell us one more time, what is the new term that the doctor?
Oh, yeah. It's for anyone who likes long medical terms, metabolic dysfunction associated steatotic liver disease, or MASLD. And there is Global Fatty Liver Day happening in June this year. And so another way to remind us all to take care of our livers.
Yeah. And I like how Anne said that her takeaway is there is hope. Yes, that's a wonderful takeaway. I also wanted to thank Just Task Voice. She did our promos, and she did our voiceovers, and she did so many wonderful things to help with the broadcast, to get the word out to everyone. And Just Task Voice, who's coming up next?
Do you struggle with tight or achy shoulders? Join us for a special session with Angela as she guides us through gentle movements to improve shoulder mobility, increase blood flow, and prevent injury on Wednesday, March 12th 3 p.m. Eastern, noon Pacific on Be Green with Amy Live.
And most of all, I want to thank you, Green Warrior, for joining us today. Your engagement and support make these discussions meaningful and impactful. And I hope you're feeling inspired to take a closer look at your food choices and your lifestyle choices and make some positive changes for your health and well-being. And remember, every bite we take, every move we make, it's an opportunity to nourish our bodies and, like Dr. Pierce, become the healthiest versions of ourselves. And I would love for you to stay tuned for more empowering content. And please subscribe to my channel and check out Dr. Pierce's social media. And maybe you can look on the website also to see what they're doing. And just share our message with others who can benefit, because together as Green Warriors, we really can make a difference in the world and with ourselves. Absolutely. And if you would like to get from me, I have 5 free recipes to share with you. So if you go to my website, begreenwithamy.com/join, I'll send them to you. And they're delicious recipes, and you'll get to see me do some fun things and some pictures that I'll share with you what goes on behind the scenes. And if you'd like to join me and Dr. Pierce as he helps me say my tagline, because you can say it in the comments. Are you ready, Dr. Pierce?
Ready.
Okay. Well, until I see all of you again, remember, be strong, be well, and be green. Thank you, Green Warriors, and thank you, Dr. Pierce, for joining us. And we're going to see Dr. Pierce next month, so stay tuned.
Now you can get 5 free whole food plant-based SOS-free recipes from Be Green with Amy. Just click on the link in the show notes and Amy will send you 5 free recipes, motivational quotes, and more so you can be strong, be well, and be